FDA officials received some tough questions today on how the agency is determining guidelines for approving that much-anticipated vaccine. Infectious disease experts pushed agency leaders on the process of collecting safety data and how they evaluate vaccine candidates. FDA staff said they would gather opinions from experts before signing off on any particular treatment. At least 4 companies are currently in late-stage trials here in the U.S. And joining us live now to talk about this meeting and the efforts to develop a vaccine is Dr. James Baker. You can see just a few of his qualifications there on your screen. I'm going to get to the FDA and the vaccine issue in just a second, but Doctor, I really want to kind of start with where we are by the numbers here in this country. The biggest story in the country right now is this explosion of COVID that we are seeing. The headline that I'm looking at, U.S. could soon see the highest number of COVID-19 cases ever on a daily basis. That according to the Surgeon General. Thursday had more than 71,000 new cases, the highest in 3 months. Hospitalizations up in 75% of jurisdictions across the country. More than 41,000 people now in the hospital. That's a 33% increase just since the start of the month. And particularly hard hit Sunbelt, Midwest, and northern states. The numbers here are scary and abysmal. Where are we in terms of fighting COVID-19?
Well, quite honestly, Ron, I don't think we quite know where we're at. We're having a third peak of infection. This peak looks like it's very similar to the one that was during the summer. The good news is that the number of deaths and the number of truly seriously ill people are much less than they were in the first 2 peaks. And that's probably because, number one, we're treating people better, but number 2, younger people are being infected and they don't get as ill from this virus. So clearly we're undergoing a third peak. We need to be very circumspect in how we handle it and how we handle our public interactions. We just don't quite know where this will go yet, but I do believe that if we do the appropriate things with masks and with social distancing, we'll be able to drive these numbers down again.
And perfect segue into this next question. According to a study just out, if 95% of Americans wore masks in public, more than 100,000 lives could be saved through February. The study notes that 49% of U.S. residents currently say they always wear a mask in public. Here's the startling part. At that rate, and with states continuing to remove social distancing mandates, the U.S. death toll could reach 1 million. By the end of February. On top of that, Dr. Fauci, infectious disease expert, for the first time ever tonight in the last few minutes, calling for a national mask mandate. Again, the numbers are scary. What's your advice to the public as the death toll and the case count continue to soar 8 months in?
Well, clearly by this point, everyone should understand they need to wear a mask. It's not a political statement, it's a protection. And a protection not just for yourself, but the people around you. I think it's hard to really look at these numbers and understand exactly what's going to happen. The number of deaths has dropped, and that's reassuring. But I agree that we must be very careful. We must be aggressive in trying to make sure that we don't spread this virus, that we don't have large gatherings, that we wear masks wherever we go to avoid having to shut down the country. That would be tragic if we had to do that again.
And I don't want to ignore the vaccine issue. I did want to deal with those numbers immediately. In 30 seconds, a little bit about how you think the FDA is going to proceed in terms of getting this vaccine to market and how as an agency can overcome some pretty healthy public skepticism about the effectiveness and safety of that vaccine once one's available.
Yes, Ron. Yesterday was probably the most important day in the development of COVID vaccines. The Independent Advisory Committee for the FDA was very tough and pointed out that both efficacy and safety need to be proved. And in fact, the one consensus that seemed to come out is that these trials should continue even if there's an emergency approval to make sure that these vaccines are safe. It leads me to think that possibly the first vaccines out will have limited distribution until better safety data is available. But the most important thing is that these were independent people, they're scientists, they're public health people, they understand the issues, and they're going to make sure that these vaccines are safe before anyone gets them.
And in 10 seconds, your estimate for when we may see one come to market for general public use?
I think that most people believe it'll be next spring or summer before there'll be general availability. We will know whether or not they work before the end of the year.
Dr. Baker, thanks so much, as always, for being with us. Appreciate your time.
Thank you.